Pleasure to have with us Dr. Srinivas Murkhi, the Chief Neonatology from Fernandes Hospital, Hyderabad. His topic in the conference in his session was on care bundles in NICU. We request Sir to give us an important summary or gist of his session.
So, care bundles are one of the easiest methods and the best methods to implement in the NICU to improve the care. We know that there are a lot of evidence-based interventions in each aspect of neonatal care, but each of these interventions, when you bundle them up together, then the outcomes are better rather than going single. So we discussed today the bundles related to CLABSI, that is central line associated bloodstream infections, ventilator associated pneumonia, nutrition bundle, IV care bundle, and preterm care bundles. So coming to the first one, CLABSI bundle. CLABSI bundle is the most famous bundle. It is already shown in all the quality as well as randomized control trials that using a CLABSI bundle is definitely decreases the incidence of your late onset sepsis as well as bloodstream associated infections related to CLABSI. It has two components. One is a line insertion bundle and line maintenance bundle. There are different components to it, but most important thing is to have a package tray when you are using a when you're doing a CLABSI. Ensure that it is being done in a strict aseptic procedure, meaning it is almost like a surgery being done on the baby. So cap, gown, mask, skin preparation should be adequate. And every time you should give a chance to see is it required or not. So time to exit policy should be very strictly monitored when you're putting a line. The maintenance part of this, so have as less ports as possible, and when you're accessing the port it should be a needleless access, or if you're using the hub, clean the hub at least for 10 to 15 seconds with a chlorhexidine swab, allow it to dry and then use medications through that. Do not use TPN or do not use blood products through these central lines. The next is the VAP bundle. VAP bundle is very important to prevent infections in India. VAP in ventilated babies is about 40%, which is very high compared to the rest of the world, and bundle approach will help you to prevent VAP. The components of bundle includes hand hygiene, again hand hygiene, hand wash or hand rub, then intubation and ET tube care, which includes the correct method of doing ET suction, avoiding stock solution, using separate catheter for each suction, and then ensuring the tubes are placed parallel to the baby and not perpendicularly holding on to the baby. Ensuring that gut prophylaxis is being done, meaning you need to feed the baby and don't give antacids. Apart from that, oral hygiene can be done with breast milk or colostrum while the ventilation is going on, and always have a readiness to wean baby from mechanical ventilation. The third component of the bundle is a nutrition bundle, where we have published some work on the nutrition bundle, which should include right from birth, giving early and aggressive enteral parenteral nutrition including high amino acids, high lipids, and switching over to complete enteral feeds as early as possible, and using mother's milk, using more of colostrum, and also using human milk fortifier in all very low birth weight babies, and also following with a good kangaroo mother care. The fourth bundle is the preterm care bundle. Preterm care bundle involves some obstetric interventions and some neonatal intervention. Obstetric interventions will include antenatal steroids, antibiotic for PPRM, delivery in tertiary care, magnesium sulfate for less than 30 weeks, and delayed cord clamping. The preterm care bundle will include early CPAP, early resuscitation, early surfactant, hypothermia prevention, and then shifting to the baby to the NICU as early as possible. The last bundle, most important for our country, is IV care bundle. Just like the central line bundle, you need to have IV care bundle where you put the thrust on IV cannulation at the insertion and also maintenance. So a bundle approach will help you to take care of the babies much more efficiently and in more cost effective way.
That was really enlightening on the bundle approach in NICU. Thank you so much, Dr. Srinivas Murkhi.